Hi, good people. Hi, TIs. It's Sherry, and I'm here with some free and valuable information for you. Some information that's going to help you to benefit yourselves as well as each other. Okay, today's research and review video is on an acronym called F.A.S.T, okay, which is what I'm going to be when I'm explaining this. Okay, it's an acronym that helps you recognize and also test for the signs of a stroke in either yourself or others, okay, so that you can help them. All right, this video is for all of us to help each other recognize and test for these signs if someone is having a stroke. All right, so just a little side note, strokes are, and I know this for a fact with my own two eyes that I've seen, they are one of the leading causes of disability and loss of function here in the United States that I know that I've seen personally. So I know this because I went to school for it. Also, I've worked actually in real life settings, both long-term care nursing homes and hospitals on the rehab units. So I have seen firsthand patients and residents living with the after effects of loss of function and mobility and cognitive function and everything from the effects of a stroke. So this is a very important issue, and it is very real, no matter what the age. So this video is for all of us right now, okay? All right, I just want to say I'm not a doctor nor a nurse. I have worked in the environments among them, and so I do have a little bit of insider knowledge that I can share with you guys, so that will be helpful, okay? Again, the acronym is F.A.S.T, okay? B-E-F-A-S-T, excuse me, 6 words, okay? And I'm going to be fast in explaining this. All right, okay, so what is a stroke? A stroke is also called CVA, okay, cerebral as in the brain, vascular as in vein, arteries, vessels, okay, and cerebral vascular attack, okay, so also known, you can call it a brain attack, much like a heart attack. It's a brain attack. The same issue happens, okay, and I just want to show this little illustration here. Yeah. I got to pull these out. I printed these up a long time ago. I'm like, am I ever going to use these again? Yes, here we are. Anyways, picture of the brain. The brain, housed in your cranium, is an organ. It needs blood flow and it needs oxygen, okay, to function, okay? Also, on a deeper level within the brain is the electricity of it all, right? The neurons. Those are the things that send messages, that send signals to the muscles and to everything, to move, to speak, to lift your tongue, to lift your diaphragm, to talk, to walk, to go to the bathroom, sex drive. Everything is housed in the brain, okay, which is made up of the organ itself and the circuitry of it, okay? So very interesting. When you have a stroke, when someone has a stroke, what happens is a blood clot, okay, branches off, and it blocks these vessels, okay? It blocks these vessels, okay? It's a little clot in there. So what happens then is the blood can't flow, and it causes damage to the tissue, and it kills the actual neurons. And again, the neurons are responsible for sending the signals to the different parts of the body and the brain to function, okay? So that being said, brain damage is a real issue from strokes, okay, resulting in both mental disability and physical disability, because the brain controls, the motor cortex controls the body, right? Okay, they're not separate, they're they're together. Okay, so time equals brain. Remember that the amount of time that you have from when you have a stroke to get to the hospital and get treatment is important, okay? We'll explain that. Just let's get to it, okay? So now, with a cerebral vascular attack, a brain attack, a stroke, there are two main types. I'm sorry, I have somebody in the background here that you guys can't see right now, but anywho, 2 types of strokes, okay? One is a major one, and that's the hemorrhagic kind, and that's where the blood vessel actually bursts, ruptures, okay, and the blood leaks into the surrounding tissue and everything, and those are the major ones. Those are the ones that can sometimes kill you on when it happens, okay? They're so severe, and many times those are caused by like trauma, car accidents, something, getting hit in the head, things like that. Okay, so now the other type, the second type that I researched was the the TIAs, they're called, or mini strokes. They're not mini though, because they can cause severe damage, but mini in the fact that the blood clot itself is transient, meaning okay, if you can picture the brain, the vessels and everything in the brain, and there being a blood clot in there, okay, so like a full clot would like totally block one of these vessels, right? A transient one would only block it like partially, okay? So there would be some blood flow still getting to the brain, but not all the way like it's supposed to be, right? So it would still cause damage, okay, at the end of the day, but not as severe and not immediate death like the hemorrhagic strokes can, okay? But again, can still cause severe brain damage. So yeah, so, and time is brain. Okay, so those are the two types. I just wanted to mention that. Now, again, with the brain damage that ends up happening, again, I'm going to show you guys a picture of the brain. I thought was really nice. I don't know, I was really into the brain. I have really researched this stuff, you guys. I find it fascinating, you know, because that's how we operate. This is our personality, our free will, our everything is housed in our brain, you know. I mean, of course, we're physical too, you know, but our brain controls our whole, how we see the world, how we relate. Anyways, so it's fascinating, and I did a lot of research on it. I'll show you guys this little picture here. Okay, this is the functions of the brain. If you can see, this is the stem, okay? So, all right, and this is the front part of the brain, which that's where the motor cortex is housed. Motor meaning all type of movement, big movement, you know, walking, to small movement, you know, writing, you know, coughing, stuff like that. So any type of movement, all is controlled in the brain. In this little center, you know, you got the touch right here, taste, hearing, you know, the audio cortex is right here. Memory, processing, you know, decision making, speech, smell, which is a big thing where you can kind of tell sometimes when people are developing dementia or even things like Parkinson's. A lot of neurological diseases with the brain affects the smell center of the brain. So that's something I remember from school, and it was fascinating. But yeah, decision making, you know, planning, you know, this is how we live our lives with all this function right here. And when you have a stroke, you know, a blood vessel that gets, you know, a blood clot, that can damage this. So all these functions are damaged, you know. To what effect it differs, and I've seen it, again, I've seen it firsthand. So it's interesting. I can talk about it, and I've actually seen it in real life. So I just want to share that with you guys, okay? So brain damage, you know, it's not it causes disability, you know, to the point where you know, could not function without help, okay? So so that being said, also physical, again, the motor cortex. With strokes, you'll see if someone suffers it, sometimes it can be, I would say, less severe, where maybe they have to walk with a limp now, or they walk with a cane, okay, because that part of their body was damaged. Or it can be more severe. They might, you know, have to use a wheelchair, you know, or a walker, and they might need help, you know, transferring. They can't get up and go to the bathroom by themselves from their wheelchair. You know, they need somebody to stand by and assist them so that they don't fall, right, causing more problems. Also, too, it could be severe to the point where total paralysis. They can't move at all. You know, that whole side of their body that's affected by the stroke could be paralyzed. Okay, I've seen that. So again, the effects of strokes. All right, so be fast. Let's recognize the signs and symptoms of a stroke, and find out what we can do next to help, okay? All right, because time is brain, okay? And to avoid more brain damage. All right, so if you see someone having a stroke or see the effects of it, there are a couple different treatments for it. One of the main ones being, first, when you get to the hospital or whatever, they're going to scan your brain to tell. They can look at the vessels and tell if there's been some type of stroke, okay? Also, too, the treatments, a lot of them are blood thinners, okay? And there's also something called TPA, T as in Tom, P as in Paul, A as in Apple, and that stands for, I had to write it down, tissue, of course, tissue plasminogen activator. Okay, so tissue plasma something activator, some type of blood thinner. It's some type of medication. They have to use an IV and put it through your arm, was what I was reading. So, but the goal is, in the end, is to dissolve the clot. as it were, okay, which is what a stroke is. Dissolve that blood clot, okay, big or little, dissolve it. Now, also too, they have a procedure, much like with heart attacks, same thing, blood clots. It's called a thrombectomy, where they have a tool, and they can go in through your leg, through your groin, okay, and go and remove the clot, as it were, wherever it's at, if it's in your brain or in your your neck, whatever vessels, and they can remove it, ideally, retrieve the clot, okay, and clear that excuse me, clear that vessel, okay, saving the brain tissue from becoming more damaged. That's why it's important that you move fast with this, okay. Be fast. You got a 2-hour window, actually, 2 hours from the onset of the stroke, where they can excuse me, which is the best time frame to avoid permanent brain damage, or decrease the amount of brain damage, okay. So again, what is the brain? What does it control? Memories, functioning, bodily damage. So that's important. It's important, you guys. All right, one thing I wanted to mention was, if someone has a stroke, there are certain hospitals that specialize in stroke recovery. So stroke recovery center hospitals was what was mentioned in the research that I did, and I do know this because I worked at one of the heart hospitals. With those type of hospitals, they tend to be a little bit more specialized. They have the equipment on hand needed. I think the doctors, the techs, the staff, they're just a little more specialized and receive a little bit of extra training for that. Okay, so you might want to look into that in your area, the stroke recovery hospitals. If that ever happens, okay, or tell the ambulance people that's where you'd like to go, if that's an option for you based on your insurance or whatnot. Okay. Risk factors for having strokes is heart issues, okay. So things like, you guys already know this, right? Blood pressure issues, cholesterol, thick when your blood is a little thick, AFib, when your heart doesn't beat, when it has a little bit of a irregular heartbeat, okay, because when it beats irregularly, that agitates the blood more, and you're more likely to get a clot, okay. Makes sense. It's not flowing smoothly, okay. So diabetes also, they said, is a risk factor. Smoking, we know, because that causes a hardening of the arteries, and the arteries is what the blood flows through. So if you're smoking, and I know I used to be a smoker, I'm not judging, I know, I get it, but when you smoke, you're putting yourself more at risk, because every time you smoke, that's causing your arteries to harden and thicken, so the blood can't flow through there as smoothly as it should be able to, which can cause blood clot, which can cause stroke, okay, which can cause brain damage, okay, which you don't want. None of us want that. Also too, I would say that's, it's harder on your community and society, because then you have to you need help, which is fine. But if you can avoid it, or if you can decrease your risk factors by quitting smoking, or also to excessive drinking, I'm not sure exactly what the correlation is, but that was one of the risk factors. Drugs, also certain medications like birth control, also hormone replacement therapy. So those things were mentioned. Things to help. Okay, things to help decrease the risks. They said to try to have a balanced diet, try to not have too many things that will, cause heart problems, right? Lots of butters, lots of, oils, etc., etc. You guys can research that, right? A heavy meat diet, right? Also too, and I know this to be true, people laugh at me, but yes, sleeping. You need sleep, okay, because it helps. And one of the things I always read, and I know this to be true, is that shift workers, people who work night shifts, are more susceptible to having strokes because of, you're going against your natural circadian rhythm, by staying up all night, and you're kind of getting more sleep deprived, because when you work the night shift, you never do really get a good night's sleep. That's just how it goes. You try, once in a blue moon, but in general. So anyways, but sleep, okay? So sleep is important. Also, decreasing stress is important, as we all know. As much as we can. Did I say sleep? Yes. Also doing fun activities, decreasing stress, doing more fun things, relaxing, and then knowing your family history and your diagnoses, your medical conditions, if you have them, making sure they're treated and not untreated. If you have blood pressure issues, if you have diabetes, just making sure that those things are in check as much as possible. Okay, so let's get to it. Be fast. Here we go. All right. Be fast. The B stands for balance, as in if you've had a stroke and it's in your brain, it's going to affect your balance. So that's how one of the ways you can tell if somebody has suffered a stroke. And also dizziness. Okay, so that's the first one, B. Second one, E, for eyes. Okay, double vision, blurry vision, sudden blindness. I actually had a friend one time who was driving on the freeway and had that type of incident. I remember she pulled over and she called me and she was so upset about it. And I wish I would have known then about this, because we couldn't figure out what it was. I just told her, to go to the hospital, and I'd go with her. But thinking back on it, knowing what I know now, I think that might have maybe been a sign of like a mini stroke. I don't know, who knows? But what person just suffers random blindness, suddenly? So I digress. Anyways, that's the second one, E for eyes. Okay, third, F as in Frank, for face, facial drooping. Okay, again, if your brain has a blood clot going on, okay, and it's blocking things, okay, your face is close to your head, so those muscles are going to be somewhat, excuse me, I have a little friend here. He's attracted to the paper. When he hears the paper crinkle, he's on it. So that's what's going on. Anyways, with your facial muscles, those can also be affected by having a stroke. So that's one of the signs. Okay, also you'll see a little drooping. Okay, also too, one of the ways to tell is to ask somebody to smile, because again, it takes muscles to smile, and if they can't, or if it's lopsided, that can be one of the signs. Okay, also A, the next one, A stands for arm. Okay, with your arm, ask them, and I've seen the nurses do this, the nurses and the doctors, can you lift your arm up? Okay, because a lot of times if someone's had a stroke, they won't be able to. Why? Again, that blood vessel that controls the motor has been damaged, so your body can't send the signal to your arm muscles to move it. Okay, so that's one of the ways. And again, everything that's closer to the brain, the face, the facial drooping in the arm, okay, and the eyes. All right, next one, S as in Sam. Okay, be fast. The S stands for speech. If somebody you think has had a stroke, or yourself, ask them to say something, and are they having problems saying it? Does their tongue heavy? Are they slurring it? If it does it not make sense, can they not repeat your phrase? Say a phrase to them, a simple word. Can you say ball? Can you say cat? Can you say dog? Can you say house? See if they can say that word, because of course we all should be able to. But after you've had a stroke, that area is affected, so that would be one of the signs. Okay, lastly, T. Okay, T for time. Time is brain. Brain is time, meaning brain damage. The quicker you can get yourself to the hospital and get the scan and get those blood thinners, or have them go in and remove that clot, with the thrombectomy, the sooner you can save that brain, that blood flow can be restored, and you can save yourself from having more brain damage. Okay, you don't want brain damage, right? None of us do. I've seen it. I've seen it with my own two eyes. I've seen the effects of it, and it's hard. It's really a hard way to live. Okay, so we want to avoid that. Time is brain. Okay, so then what would you do if this is for yourself or for others? If you see this, you've done all these are the little tests you do. Again, balance, eyes, facial drooping, can't smile, lopsided smile, can't hold their arm up, speech problems, time, call 911 or whatever emergency services, okay, and see if they'll take you to a stroke recovery center hospital. Let them know that you think you've had a stroke. Okay, so yeah, that was it for today. As always, I thank you guys for your time. Don't forget to hit like and subscribe so you can get more videos like this, and you guys have a great day. Thank you. Goodbye.